Hi, I'm Dr. Hale. Today I'm going to talk about surgical options for Tailors bunion or bunionette. A bunionette is similar to a bunion, but on the outside of your foot. A bunion is on the inside of the foot behind the big toe, and a bunionette is on the outside of the foot behind the fifth toe. The bone behind the fifth toe is the fifth metatarsal, and when the head of the fifth metatarsal moves outwards, it causes a prominence. Surgery is indicated once you have exhausted all conservative options, including wide tie-type shoes, shoe modifications, padding, and orthotics. In the majority of cases, a bunionette is caused by the displacement of the fifth metatarsal head. In some cases, people do form a bony outgrowth, which we call a bone spur. To correct the bunionette, we must move the bone back over. A simple spur removal will not help if the bone continues to be displaced. Next, I'm going to describe the surgical procedure. The surgery requires a skin incision to allow access to the bone. A small amount of bone is removed from the outside of the fifth metatarsal head. The fifth metatarsal head is then cut and moved over to alleviate the deformity. There are two different bone cuts to allow the head of the metatarsal to be moved towards the inside of the foot. One type of cut goes top to bottom, vertical, and a wedge of bone is removed to move the head of the bone over. The other type, a horizontal cut, cuts from outside to inside, and the bone is moved towards the inside. I've been doing this procedure for many years. Previously, we did a lot more vertical wedge cuts, but the complication rate was higher, and the patients had to be off their foot longer during recovery. Overall, any straight vertical cut is more unstable with the weight bearing. For most cases now, I remove a small amount of bone from the side of the metatarsal head and then make a horizontal cut, which allows for more stable fixation and early weight bearing. To allow faster healing of the bone, a small screw is utilized to stabilize the bones. The screw can be removed if necessary, but removal is not required. We only remove the screw if the screw head causes discomfort. After the surgical procedure, you typically have to be on crutches for approximately 2 weeks. We have to take it easy for that time to allow the incision to heal. Even a small incision takes 2 weeks to heal. It takes about 6 to 8 weeks for the bone to heal, no matter what procedure is performed. You may be in a postoperative shoe or below-knee boot for 4 to 8 weeks after surgery. In addition, if surgery is on the right foot, you most likely will not be able to drive until you can safely wear a shoe. When selecting a procedure, I take into account the deformity on X-ray, activity level, age, and other healing factors. I suggest you select a surgeon who is board certified in foot and ankle surgery. I strongly suggest that patients do not have surgery in an office setting for this condition, but rather have surgery in a hospital or surgery center. The hospital makes sure the surgeon has the education and experience to perform the procedure. Also, I do not suggest a minimally invasive surgery for this condition, since it has a higher complication rate. With slightly larger incision, your vital structures are clearly visible, thus the complication rate is lower with an open procedure. The bone healing time is the same no matter what type of bone cut you have. If you live in Western Washington, I strongly suggest vitamin D before and after surgery to help with bone healing. In summary, for the treatment of bunionette, a bony prominence on the outside of your foot, I recommend that you do conservative treatment first. Find a shoe that takes the pressure off the area. If this doesn't work, you have to use padding or modify the shoe and orthotics. If conservative therapy fails, you may need surgical intervention to move the bone over so it does not rub on the shoe. If you have any further questions about this or any other condition, go to our website at footankle.com. If you're interested in shoes that may help your foot condition, you can obtain our shoe list by going to our main page, scrolling to the bottom, and entering your email address. Thanks for watching.